Hello, welcome.
Just doing a sound check, Katie.
Okay, great. I'm going to adjust my volume real quick too.
Thanks.
Okay. Can you check your sound one more time for me, Dr. Martell?
Sound check.
Okay, thank you.
Thanks.
Welcome. And it looks like we're waiting for just a few more people to join us. This is the Health Impact Survey presentation. We're just going to give it a few more minutes for a few other people we're expecting to join us. Welcome to the Health Impact Survey. Just a reminder that we are filming the meeting and we're waiting for a couple more people to join us and then we're going to get started. I would just delay it another minute. We're just checking in, make sure that everyone was able to get on their link. Okay. So it looks like we have enough representatives on the call that we can go ahead and get started, and the others can join us after if they're able. So I just wanted to go through a few quick notes on the call, the logistics of the call first, just to remind everybody that today's presentation is on the results of the health impact survey following the Kim Tool fire. The presentation is being recorded, so if you have any objections to this, I would need to disconnect. The presentation is to provide the results of analysis to the representatives of the Village of Brockton and the local response. It is not intended as a media briefing. So if there's any media on the call, we just ask that you kind of get off of this call and watch via YouTube, and then as the public can all watch via YouTube, and limit those questions to those that are on the call today. And again, we'd just like to thank everyone, the chairman, the representatives from Rockton, Pat Lewis from our Board of Health for being on the call today with us. And so now we'd like to introduce our Public Health Administrator, Dr. Martell, who is going to give our presentation today. Dr. Martell.
Well, first of all, thank you for your time and attendance in a sunny afternoon. It's important to understand this is our first kind of really review of the results that came out from the health impact survey. So Katie's going to be advancing the slides. So I'm going to have her advance to the next slide. Just to kind of give you a little bit of sense of how it's going to progress today. There'll be a very brief overview of the background of the Kim Tool fire. Remember, the purpose of this is not to go over the actual response and fire suppression activities. It's to really understand what the impact of that was on the environment. Then we're going to take a look at the health impact survey data that was reported. And we do have some preliminary on our pet and livestock survey that was a follow-up as well. And then some summary action steps moving forward. So the first thing, I think it becomes important to understand that this is not the work of one entity. When the Kim Tool fire occurred, we did an immediate reach out to both federal partners. So we had involvement of the Centers for Disease Control and Prevention. That unit is the Agency for Toxic Substances and Disease Registry. This is the team that was on the ground with us here in the beginning part of July. Many of you may have met Dr. Sarazi and Dr. Nakayama, who were here doing some of the field work with Mark Johnson. We also had the Centers for Disease Control and Prevention, the One Health Office. This is the team that deals with the zoonotics, which are the animal and the pet and the livestock. And so they were also part of the team that helped us develop it. Then as we progressed down to state and local, the Illinois Department of Public Health was very much involved with us. They have to make the request with us to request the federal partnerships to come in and look at the data. And then our own Winnebago County Health Department was very much involved with this survey. So some background information regarding the chem tool fire, just to kind of remind everybody, and again, because there will be people that are viewing this that are maybe not familiar. Uh, I think all of us know it's a fluid lubricant and grease manufacturer owned by Lubrizol. It was located in Rockton, Illinois. I think the other important thing is to remember is the former Superfund site known as the Beloit Corporation. It's a 20-acre site. The cleanup was completed in 2017, so it's on the list. And that is also, if you go to the EPA website, you can look under both the chem tool fire situation and the Beloit Corporation. Next slide, please. So the timeline is not so much about response, but to understand length of exposure. So Monday, June 14th, at 6:50 approximately, the fire alarm was activated. At 8:35, the 1 mile evacuation zone order was put into effect. And then at 10 a.m., a 3 mile masking zone. So that was all on the first day of events. On Wednesday, we have a lifting of the 3 mile masking zone. And then on Friday, June 18th, we have a return to the 1 mile evacuation zone order was lifted and people were allowed to return into their homes. So we really had that Monday through Friday time span. So a 5-day time span in which exposure was really kind of measured during that time frame. Next slide, please. So just to kind of remind everyone, there was the 1 mile evacuation order, which was issued by both the Rockton Fire Department and the Winnebago County Health Department. We had the 3 mile masking advisory, which is the Winnebago County Health Department, and then environmental sampling. And there were a couple of things that came out of this that we learned about. One was uncertainty about which chemicals to test for initially. While they knew what chemicals were in the facility per se, in terms of the Lubrizol and what they did, remember industrial fires are very interesting because they're things that are burning that normally aren't intended to burn. There's furniture, there's computer equipment, there were trucks in the manifest, there were all kinds of things that had to be tested for and looked at. Multiple response agencies were involved in that. Again, both at the federal level, we had the U.S. Environmental Protection Agency on site, the Illinois Environmental Protection Agency, the Illinois Civil Support Team, which is a part of the National Guard, as well as ChemTool had a contractor, the Center for Toxicology and Environmental Health, known as CETA. So what were some of the initial environmental impacts that we had looked at? So one, I think to the left, this is when the federal partners come in. This to the left is a photograph that was taken from a space satellite. They think this is pretty intensive to see that plume. They could see that from space. You can see the identified. And again, it was a southeast directional flow. And to the right was really a diagram of soot concentration on June 14th that was done by our own team here, which is the WinGIST group had mapped that out. So you see two different kind of imagery showing really the directional flow was southeast from the actual, I'm going to say, point of the chem tool fire. So who was assessing that? We talked about that, the public agencies. We had the Illinois EPA provided data for both the Superfund emergency response and the Illinois Civil Support Team, which is part of the Guard. We talked about that. They conducted what we call multimedia environmental sampling. And for those of you who participated in some of the press conferences and looked at the data, we typically kind of group it into air, land, and water. And land, we include the soil in that. Results were posted on agency websites, both the Illinois EPA posted as well as the US EPA, and they continue to post results on those sites. We also had private environmental impact assessment. And we talked about chem tool contractors used the CETA, did some air monitoring, and Clean Harbors was their debris pickup and disposal. And they also did testing of the materials that were being picked up along the way. So we had lots of information coming in from a variety of different contractors, both private and public, federal and state. I think the other part is that people often talk about the evacuation zone. When we looked at it, we would divide that up into quadrants. So when we were looking at data about when to lift certain orders, we were looking at the data coming back in from those quadrants. Knowing that the southeast was the predominant, we really wanted to make sure we were getting results back from quadrant 3s and quadrant 4 to make sure we could return people safely to their homes. Next slide, please. So I'm going to be showing quite a bit of these graphs. And I think the important thing to understand is you're going to think, wow, they look very similar. We learned from our federal partners that purple is used as a color because we don't really necessarily want to talk about heat. We don't want to talk about different kinds of things. This is what they call a kernel density map. So first of all, we looked at the location of individual debris properties with fire debris, which were found up from 15 miles from the chem tool facility. And these were reported by Clean Harbor. So they actually reported every address that they received a call on for which they went out to clean up debris. So 15 miles was the span of this. Then we're going to show you the density plot is showing where most of the fire debris was found. So while there were many calls across that 15 mile, as we would expect, this trended a little bit more south, a little bit southwest, but it was predominantly south. You can see that the majority of debris was picked up within that 1 mile radius and then coming out a little bit to the 2 mile. The red dotted line is the 1 mile radius. Next slide, please. So where were the water and soil sampling locations? The soil sampling occurred at about 35 different sites and water sampling is at 23 sites. And when you look at that, you can see all the different, you look at blue as water sampling, yellow was the soil sampling. The red kind of triangle was a monitoring well, which is on this former Beloit Corporation. Other points of, areas where they were moving equipment around. They also had U.S. Army sample locations, and Bureau of Land and Water came out to do sampling, and they're like the blue kind of comma box. So there was a lot of sampling going on. If you were to look at kind of from the center of that diagram out, the amount of sampling that was occurring was throughout both the north of the site as well as south and southeast of the site. Next slide, please. So when you look at wipe and soil sample locations, this was looking at the land. Yellow, you can see the chem tool. And again, the idea was to predominantly sample southeast of the plume, from that site. So you see a significant number of sampling occurring at various locations throughout that area. That if you were to look at the debris sampling and overlay that, they'd be very similar in location. Air monitoring locations, these maps identify who is doing, different kinds of sampling, but the purple dot was the chem tool asbestos survey. Then they did the evacuation zone monitoring locations where the red circle dots. This permanent air sampling location was a green. And then we had movable stations from what they call the CST, we talk about the civilian force as well as the EPA. So you see the blue and the kind of purplish square areas where they were sampling along those air monitoring. The idea being, again, air sampling was moving around. If the plume changed, if the wind direction changed, the idea was to create as much comprehensive sampling as possible. So this is not kind of just to give you an idea of all the different things that they were looking for in terms of air and what types of tools that they were using. So you can see they were looking for particulate matter. The Beloit Corporation was formerly known for the VOCs, which were the volatile organic compounds. They were looking at hydrogen cyanide, sulfur dioxide, hydrogen sulfide. And then different kinds of, you can see CETA was checking for benzene. They were also checking for the metals in both dust wipe, debris, and soil, and surface water, the semi-volatile organic compounds, the PFAS and asbestos. So they were really going through a variety of different areas so that you can see all the different kind of environmental monitoring data that was going on. And again, the point is not to really talk about the specifics on the environmental, but to really understand how the health impacts kind of mirrored up some of the information that we received from the environmental monitoring data. Next slide, please. So this was kind of some of the, breaking it down to some samples. So on Monday, June 14th to Tuesday, June 15th, they picked up what they, at the chem tool facility was stationed to what we call high particulate matters about the PM 2.5 and the PM 10s. Just think PM means particulate matter. And so the public health level was screening was exceeded at those at the level of 8 and 5. So we'll go to the next slide to show you some other monitoring data. So we know right near that area of the chem tool, station 2, that it would expect it. And then we have this area on dust track 312, which was kind of coming out on the 1 mile evacuation. And why we held on some of that was Tuesday, June 15th to Wednesday, June 16th. Again, we had the particulate matter 2.5 and particulate matter 10 exceeding the public health levels. Now they were lower than the actual chem tool from the previous day, but still we were out in that 1 mile evacuation zone and we still are getting exceedances beyond the public health level. So here we are coming into Thursday, June 17th to Friday, June 18th, which was at 1:53 in the morning. At that point, we started to begin to drop. The handheld were exceeding. We still had some exceedances, but they were nowhere near the level that we were seeing in the previous day. So clearly, as time was marching on, the exceedances and the levels were decreasing in the areas of concern that we had, which were particularly particulate matter, and then in size 2.5 and the 10. But if you look above and you wanted to know a little bit more about some of this, the multi-ray, there was no hydrogen sulfide, no hydrogen cyanide, and no volatile organic compound. Next slide, please. So the majority of what the finding was is that we saw particulate matter. We saw the exceedances, and that's what we were being picked up on. And what is the concern in terms of health regarding particulate matter? There's been a significant association between particulate matter and cardiovascular. We would expect to see arrhythmias and heart attacks. In the pulmonary respiratory, we expect to see asthma, bronchitis. If you were to look over a long period of time, we think about restricted activity days, lost work or school. We often think about ozone pollution. You think about some of the areas that oftentimes have high exceedances. This is where, for long periods of time, you may see people out of work or school due to the respiratory, and increased emergency department visits. In particulate matter, size does matter. The particulate matter of 2.5 is smaller and finer. They pose a greater risk than the larger PM of 10s to 2 point that area, because the smaller particles can go deeper into your respiratory and circulatory systems. The larger particles are much more coarse, and they're more likely to cause irritant to eyes, nose, and throat. So when you start thinking about what kinds of health impacts we would be most likely to see, at the 2.5, we're going to be talking about respiratory and heart. And if we're talking about the larger, we're going to talk about those irritants to eyes, nose, and throat. So what did we find about the health impacts? So we'll talk a little bit about overall, these are what we call descriptive statistics. Just to understand the collaboration, we have to request that support. We requested from the state immediately. We felt it was important to understand what are the potential health impacts typically associated with chemical fires. There's been a lot of data out on what we call wildfire smoke, but there had not been a lot of data collected on what was associated with chemical fires. We needed to understand our community and assess the health impacts. And we really wanted to identify correlations between environmental impacts and health impacts. So the state would request the assistance from the Centers for Disease Control and Prevention to support us. And so we worked with what the teams were that you saw initially, which is the EPI-AID group. And we adapted the assessment of the chemical exposures, what they call the ACE investigation, to evaluate health impacts. They have a panel of questions and things that can be pulled from to really identify and be tailored to an event so that we could start to taking a look at. And they helped us to work to analyze the results of the health impact assessment. So one of the interesting things, we talked a little bit about that kind of, what do you think when you see a particulate matter? We talked a little bit about hospitalizations. We talked about MAPA visits during the 7 days post-incident. Areas with the largest number of visits were southeast of the chem tool. So what you see in this diagram is actually out of what we call essence data, which is surveillance data that's done by hospitals. There's nothing special that occurs. They routinely monitor all emergency department visits. And what they saw was an increase overall in the 7 days post-incident in emergency department visits in the blue and green zip. Katie, can you step back?
Sorry.
It's okay. In this, if you notice the zip codes, you're starting to see the number of visits, the blue and the green kind of areas, so that as the closer it was in that southeast area, they were more likely to have an increased number of emergency department visits. Now, was this caused? I want to make sure that everyone's here. It is not causative. It was an interesting indicator that we needed to take a look at further. Next slide, please. So part of that essence also gathers, data. We talked a little bit about what that happened. What we saw was overall emergency department visits peaked on June 14th, which was the date of the event, which was 15% over baseline, but it quickly declined. In addition, we had it mapped against the particulate data of the 2.5 from the 2 Winnebago County stations, which is, you see that the brownish line, and you see the alert going up on that yellow. So you see, even before the event, we did have particulate matter in the environment, but we did not see that increase kind of until the June 14th, which was the day of the event. But then it quickly drops down in terms of hospitals. Next slide. But what we did see in the essence data, and again, we don't go into this, does not tell us who it is or what it is. It simply says, what did we see an increase in? We did see an increase in alerts for nosebleeds, weakness, and suicide. These were 3 things that increased significantly on that June 14th that was driving up those ED department visits. But what we didn't see an increase in alerts were anything with altered mental status, asthma, GI bleeding, rash, burns, or a cluster what they call disaster-related mental health symptoms. So why are we kind of going over this? Because one is it helped us to decide which questions we wanted to pull from. We knew we had particulate matter. We knew we had those blips in emergency department visits related to suicide, related to nosebleeds, what we didn't see were things like GI, skin, and burns. So we began the adaptation of what's called the Assessment of Chemical Exposures Kit, or the ACEs. What was different and what we used this time was it was self-administered. For those of you in the community who may have gotten vaccinated through us, you had pre-registered on our Qualtrics system. And what we did was we started a push out for all of that. We said we can adapt that survey response tool and be able to build those questions in. For the most part, it was self-administered, although we did provide hotline assistance for individuals who did not have access to computer technology. We emailed to approximately 45,000 individuals in 11 zip codes. And included those zip codes where we saw the increase in hospital visit rates from those zip codes. In addition to, we had push out from both press conferences, social media. I know the Village of Rockton posted, the health department, and we pushed it out through the hotline as well. If anyone came with a question on ChemTool, we asked them to complete the survey. Next slide. We also had fieldwork investigators, so thank you to anyone who allowed these individuals to knock on your door. These were members of our CDC team. We also, if you look on the left, was the flyer that we had put out in English and Spanish. In addition, this team also conducted interviews with community leaders who were leading the response, residents, and community agencies that were supporting various activities around this event. Next slide, please. So timeline of response. Some of your community found out even before we began the July 1st press conference, and we started to see about 47 surveys were completed, and it started trickling along. It was really the email that we sent back out to individuals in those zip codes that really drove up the response rate. You can see a significant increase from that timeline. So our goal was to try and get as large a sample size as possible. July 13th, we did a press conference kind of reminding people where we were at and what we were doing. July 14th was kind of a handbill flyer distribution in the community. And July 15th, we closed the survey because, again, the idea was we really needed to be no more than a month out for people to understand what was going on. Remember, the event was June 14th. And so that initial impact, we needed to really get that closed out. We didn't want to start getting longer term. We wanted to get some short term. What was the immediate impact? Next slide. So what did we include in those health impact surveys? Well, you're going to hear about demographic characteristics similar to what we do in the census, where the location was, where you were during the event timeframe, right? Because it really became important to understand what materials you may have been exposed to, whether it was smoke, debris, or dust, symptoms, whether they knew or they worsened within the 2 weeks after the event. If people used healthcare services, including self-care, we understand during a pandemic that many people would have maybe taken different alternative healthcare during all of that. We also recognize the unique, I'm going to say, geography of our area and the culture of our exposure of pets and livestock. Some of the immediate questions that came through our hotline were regarding what do I do with my pets and livestock? And so we did a follow-up survey for those individuals who responded. We asked a particular question if they had pets or livestock, and we sent that out. We also did a separate survey for first responders. Those were individuals who were actively engaged in the fire suppression and response. Next slide, please. So the highest percentage of survey respondents came from the 1 mile evacuation zone of the Chemtool facility. And remember, I sent out, we had over 14,000 invites. The greatest concentration, as you can see, was Southeast. The second area of concentration, as you can see down a little bit in the Rockford area, which was just southeast of the city. And really, remember, we asked people where they resided, this was not indicating where they were at the time of the exposure. And again, when you think about large urban areas, they tend to be the source of employment. So many individuals may have been working in facilities or factories along that area, been evacuated, and then completed the survey from their other areas. But remember, we saw debris for 15 miles, so it's not surprising. So what did we learn about the overall? The average age of respondents was 50 years, but we did see an age range of less than 1 year to 94 years. So that, again, we asked parents to complete it for children and individuals. 86% of the respondents indicated that they were white, 3% were Black or African American, 5% Hispanic Latino, 63% were female. And of those respondents, there were 2,033, so that's a large number. 45% had reported symptoms. So we're going to kind of talk a little bit more about that. So of that 45% who reported symptoms, 80% reported some exposure to any material. We asked people about exposure to smoke, debris, or any material, because again, there might have been other things that they weren't able to classify, weren't sure to classify themselves. The majority of respondents reported exposure to smoke. And I think that makes sense when you saw both the initial photos coming from that, as well as the particulate matter. 41% reported an exposure to dust, and 45% reported an exposure to debris. Of those who reported no symptoms, 45% said they had been exposed to materials, 31% had reported exposure to smoke, 12% reported exposure to dust, and 25% reporting exposure to debris. So what you see here is individuals with symptoms were more likely to report exposures. Odor is an interesting, we asked people about odors. And again, there is no standard measurement for odor. And this has been something that if you've been following anything in the landfill, this is part of the challenge. We asked people if they smelled an odor and then if they would describe the strength of an odor. And again, the majority of individuals reporting symptoms also indicated smelling a moderately strong odor, consistent with their idea that they were in smoke. So you can see there at 73% indicated that they had symptoms, reported that they smelled an odor, and 28% of that same group indicated that it was a moderate. So we talked about the highest percentage of survey respondents with any symptoms came from the 1 mile. The greatest concentration, again, was south of the actual area. So oftentimes we were hearing about when people ask about what was going on north, you can see very limited. The red, again, I want to orient everyone to the red dotted circle. It was the 1 mile evacuation zone. And so if you were to look north of the dot, which is the chem tool, I'm going to say ground zero place for the fire, you did not see people responding to that, and again, the majority of people responding were southeast. So the darker the purple color was, the higher the response rate. Next slide. So when we talked about, I want to kind of bring everyone back, particulate matter, one of the concerns we asked were about cardiopulmonary. So those were the cardiac and respiratory. So again, this was, when you look at this purple density, it looks very familiar to what? The number of individuals who responded to the survey and the number who reported symptoms. Again, largest concentration is in that south, it's a little more south, a little broader in perspective. But when the top 5 symptoms were coughing, 68% reported coughing, 46% reported difficulty breathing or feeling out of breath, 35% reported asthma or worsening, 21% with chest tightness, and 13% with burning in lungs. So again, consistent with what we saw in the particulate matter. Next slide, please. Now, skin symptoms. Again, we did not see, these are typically not associated with the particulate matter, but 11% of individuals with symptoms reported skin symptoms. And you see that it's much broader than just the southeast, what we would have expected. You start to see that purple is darker, it fills almost the bottom half of the circles. 30% reported irritation, pain, or burning. 29% reported a rash. The largest response group reported they had dry or itchy skin. 15% said sweating and 10% hives. But again, not as, consistent with potential debris exposure, but not as much with the particulate matter. (42% reported eye symptoms. And this is important to understand because we had that particulate matter of 2.5 and 10 showing up. Of those, the largest percentage reported irritation, pain, or burning in the eyes. Increased watering was the next highest reported. 17% reported blurred or double vision. And of course, very small percentage bleeding in the eyes. And remember, we were watching that against the particulate matter. So that again, consistent with the greatest density of responses occurring within that 1 mile and southeast of the evacuation. Next slide. Ears, nose, and throat symptoms. We were watching that, remember, from the ED department data from our Essence systems. 70% of the individuals reported a symptom reported with ear, nose, and throat. The majority reported stuffy nose or sinus congestion, 42% burning in nose or throat, increased phlegm production, runny nose, and hoarseness. But only 4% reported the symptom of nosebleed. So it was not in the top 5. So again, when we were comparing it to our data, when we had that blip in emergency department visits for nosebleed, it occurred on the 14th, but we didn't see it. And it doesn't, again, we did not see it reported significantly in the group that was responding in the survey. Next slide, please. The other concern we had was around the mental health, and we talked about that increase in suicide. So we asked people specifically about questions related to mental health. 28% with symptoms reported mental health symptoms. 88% of those reported anxiety, 54% tension or nervousness, difficulty sleeping, followed by agitation and irritability, and 27% reported feeling hopeless or helpless. And again, when you come back to mental health, you think about it, Typically, the numbers in 20 to 25% of the general population will report some kind of mental health symptom at any point. People have just come out, and I want to put people in the timeline. Remember, June 15th, we had just come out 3 days prior of into phase 5 Restore Illinois. So people have been through almost a year and a half of a pandemic. We are at this point feeling pretty good. The summer's starting, and we start Monday with a large chemical fire, and people not understanding what's going on. Where is it? What's the impact? People are potential loss of employment in the area, a loss of concerns about the environment. What's that going to mean? So again, when you start seeing, though, interestingly enough, where are the majority of this being reported? It's being reported southeast of the area, and again, highly concentrated within our 1 mile evacuation zone. Next slide. We had that question about neurologic symptoms, and again, the response rate was very similar, but we had very small reporting on neurologic symptoms. But of those that reported, 94% reported having a headache, 38% dizziness or lightheadedness, 1% reported a loss of consciousness or fainting. And if I were to put up the diagram again, we just kind of decided we weren't going to put them all up because they look very similar. If I were to ask you, and you were probably to tell me it's southeast of the chem tool fire within the 1 mile evacuation, again, was the highest reporting rate of these symptoms. Next slide. Healthcare use. That was an important thing to understand about what were people, how were we looking at healthcare? The majority of individuals indicated that no healthcare was needed, so 76%. Of those that used healthcare, the majority self-treated. And it could have been that they either took additional asthma medication, they might have, flushed eyes out or used over-the-counter eye drops. 3% were seen in the emergency department, urgent care, or outpatient clinic. 2% reported being seen via phone or video telehealth conference. So they may have called their physician's offices or medical practice and asked for guidance. But I think here's an important statistic to walk away with. Less than 1%, so 0.2% indicated that they had been hospitalized related to the event. And again, if I look over to the right and you go back up, I'm sorry, Katie, one more, back up. Again, southeast of the city was those that were reporting the highest level of healthcare use. Next slide. Next slide. So first responder survey. This was interesting because remember, there were approximately 350 first responders who were part of the initial response, and we got 31 respondents to participate with us, so about less than 10%. Of that, 30% were law enforcement, 5% indicated they were other, 65% were firefighters, and they represented 14 departments and agencies. We asked them some additional questions. We were going to ask them about their use of personal protective equipment. And 18 indicated that they had worn standard fire protection gear. 4 did not wear any listed PPE, but again, may not have had to wear PPE depending on their role. And 6 chose not to answer. In terms of exposure, 5% reported not being exposed to any material. So that may indicate the role that they had in the response. But again, we looked at a little bit about that odor. 24 smelled an odor, 3 were unsure if they smelled an odor, and 1 did not. So interesting, again, that subjective response on odor. Next question. So similar to our population, again, less than, half of them reported. So 43% of first responders reported any symptoms. And similar to the health impact of the community, the number one was eyes, irritation, pain, burning in eyes, blurred or double vision. Ear, nose, and throat, they too reported increased congestion or phlegm, odor on breath, stuffy nose or sinus congestion, runny nose, burning nose or throat, hoarseness or a tickling sensation in their throat. Like the general respondents, they too reported headaches, dizziness, or lightheadedness. Respiratory, they reported asthma, difficulty breathing, feeling out of breath, wheezing in chest, or coughing. So we did not see a significant difference between the individuals from the community that responded and the first responders that provided information to us. Next slide. So we reached out to our neighbors in the north as well. We didn't want to find out if there were some different things that they might, because we also know, being kind of a border community, that individuals may have reached out to their health systems in Wisconsin. And so we asked the Wisconsin Division of Health Services, which is the equivalent to our Illinois Department of Public Health. They also use Essence, which is a national system of surveillance. We asked them to query it using the same criteria. And we asked them to look at emergency department related to the Chemtool fire from June 14th to July 1st. They ended up with 17 what they call unique query results, meaning they found 17. They saw individuals visited the emergency department between June 15th and 24th. And they indicated there were 6 entries having direct reference to the Chemtool fire within the chief complaint, but none were admitted to the hospital. So we did not see an uptick in the far north region of, as our areas. If we were to look up onto the upper limits of our north area on our zone of evacuation, we did not see a significant change in healthcare seeking up in that region. Next slide, please. So one of the queries that came out, remember I said we found out that we asked people about their pets and livestock. And so individuals that indicated that yes, they had pets or livestock were sent on a follow-up survey. And this survey was developed with our zoonotic partners at the Centers for Disease Control and Prevention that look at emerging infection. And again, this was very interesting to them simply because many times, a wildfire is really a wood burn smoke. It may have some of the household chemical kinds of things that we talked about, the things that are not intended to burn, but they were interested in looking at that data as well with us. And so we appreciate the fact that our community was diverse enough to be able to provide some of this. So we sent it out. 453 health impact survey respondent indicated they had pets and or livestock. So similar to that, we emailed all of them and sent them a follow-up survey asking them to complete that. And we had a fairly significant response rate. For anyone who does survey research, anything above 20%, we're always very grateful. We had almost 42%, 41.5 completed the surveys, and it was representing 734 animals. Next slide, please. So clinical signs were reported by 30% of the respondents for 4 species. And we're going to call, they divided up between pets and livestock. Animals with 1 or more clinical respondents were reported by 50% of horse owners, 14% of poultry owners, and that included chicken, ducks, and turkeys, 25% of dog owners, and 20% of cat owners. Next slide. Of those responding, 4.3 reported 128 livestock. And so this is the breakdown by species. So the largest reporting was those individuals, about 72% indicated that they had poultry, again, chicken, ducks, and turkeys. 24% reported having horses. 2% thereabouts, cattle, 1.6% goats. Others that were included in the livestock included honeybee hives. I think we are becoming more appreciative of the impact on that ecospecies as well. Interesting, 15.6% of livestock were evacuated. 100% of chickens were evacuated, and 1 chicken was reported to die after evacuation, but no livestock were reported missing after this. And you can understand, you probably, if you can, from a farming perspective, movement of horses and cattle would be very different in goats versus moving of chickens. Next slide, please. So we talked about 100% of respondents reported pets. So even I'm going to say livestock owners were also reported pets. So breakdown by species, the majority were 39% were dogs. One of the areas that we have to do a little more query on is this 37.3% fish. We were not clear, and the questions were not asked to understand were these fish that were kept indoors in aquariums, were they outside stocked ponds, were they koi ponds, things like that for decorative gardens. We needed to understand a little bit more as we move through on the future on that. 18.6% cats, 3.3% birds, and in this other 1.8% other, we had rats, reptiles, frogs, and rabbits. Again, individuals were more likely to evacuate their animals. We pulled out 14% of animals were evacuated. 83% of dogs were evacuated. One dog died after the evacuation, and 17% of cats were evacuated. One cat was reported missing and not evacuated, and 12 fish were reported as dead. And so again, kind of an interesting breakout. We didn't do enough query on the fish to understand a little bit more about that, and something kind of for future reference on understanding more about impacts. Next slide, please. So we saw evacuations occurring. I know the fire chief put in place, as did we, the June 14th evacuation. They were evacuated over 2 days, the majority being on June 14th, and the second day being June 15th. And so you kind of see the mean days that they were evacuated and the range for that. You see that the longest evacuation tended to be dogs, followed by chickens and cats. And the overall evacuation range was 0 to 15 days, but the median amount was 2 days. And evacuated animals returned home between June 14th and June 29th, much more extended timeline for the evacuation than the humans to return in the 5 days. Evacuated animals, we talked about the chickens, dogs, and cats were the ones that were evacuated. Next slide, please. Kind of just interesting timeline. I think the animal team put this together to kind of show you where the evacuations occurred and who was out the longest. You see the dogs were the last to return, the 2 dogs, but the majority returned within that kind of mid-range between the 620. But you start to see a little bit outliers, the 10 chickens and a cat, and then the 2 dogs at the end. So much more longer time frame for evacuation of pets. So what were the clinical signs in livestock? So the horses, they reported, again, eye discharge, nose discharge, lethargy, labored breathing, coughing, scratching at eyes, and sneezing. And of those, similar to like healthcare seeking behaviors, we asked them about whether or not their animals received veterinary care during all this time frame or a consult. And 1 horse received a veterinary exam. And again, consistent with particulate matter, what we talk about the 2.5, you see the ear, nose, and throat kind of in addition to the respiratory. Poultry, we saw the reports of labored breathing, lethargy, inappetence, and diarrhea. And we see that inappetence and diarrhea, we see a little more GI symptom in the animals and the livestock. And again, this might be the fact that debris was on the ground. Humans are less likely, but animals may be more likely to consume from the ground. So we typically talk about inappetence, which is a lack of appetite in animals. And so you see a little bit more of a GI on that. And 1 chicken died. Next slide, please. Clinical signs in dogs was a much broader perspective. We see again the sneezing, lethargy. You see diarrhea in dogs. That again, that GI symptom that we did not see as much in the human impact, but we see the eye discharge, coughing. We see vomiting, which again, an inappetence. Scratching at eyes, labor breathing, nose discharge, a little bit different because again, animals don't have the opportunity they have burned skin or foot pads, so the skin irritation for them. There were some other signs that the veterinary group weren't sure where to classify, and so eye and skin irritation. They either found hot spots, itching, and dry red eyes, interaction with debris and compounds from fire, paw injury. They saw some tar debris stuck to paws, and animals licking ash off their paws. One dog was euthanized after the evacuation for illness. Clinical signs that dog it exhibited was a cough, sneeze, difficulty breathing, and eye discharge. But there was no medical history provided on that animal, so they cannot directly attribute it to the fire. So I mean, these are cautionary. These are just descriptive statistic. It's not a cause and effect. It's what people responded saying, these were the impacts that we experienced. 5 dogs received veterinary care, 2% of the total, and 2 were treated for respiratory infection. Next slide. So clinical signs in cats. Cats were known to exhibit sneezing, again, the particulate matter, lethargy, inappetence, again, that loss of diet. We're starting to see the diarrhea again with them, labored breathing, eye discharge, coughing, vomiting, scratching at eyes, and nose discharge. And 1 cat received veterinary care, less than 1% received veterinary care. So in summary, I know there's been a lot of data kind of out there. So what are the health impacts, the preliminary understanding? There we had a large response sample with concentration from the 1 mile evacuation zone. The 1 mile evacuation zone mitigated potential health impacts. The more we saw that as we looked at this. Reported health impacts were consistent with the environmental impacts. Most commonly reported symptoms were eye and respiratory. It was consistent with the time frame of exposure. Most did not require healthcare. Those that required healthcare self-treated, and consistent with the exposures of smoke, dust, and debris. I think the other flip side now is a preliminary, pet and livestock. We had a very high response rate from pet and livestock owners. Similar to the human impact, clinical signs were reported by 30% of respondents for 4 species. We talked about the 2 pet and the 2 livestock. Once again, the reported pet and livestock impacts were consistent with the environmental impacts and mirrored those in people affected by the fire, which most commonly reported that respiratory, eye, and lethargy. The additional reported that, again, might be more likely to how animals move about yards, what they expose themselves to, what they consume, or the diarrhea, inappetence, or lack of appetite. Again, consistent with time frame of exposure, most did not require veterinary care, and it was consistent, again, with the exposure of smoke, dust, and debris. So what are the next steps? First of all, we are what we call descriptive statistics. We just told you what people reported. And the next thing will be much more, they'll be doing some what we call cross-tabulation, understanding which ones were more likely based on all symptoms. We're going to be continuing to look at that data on the health impacts for both the human pieces. We have a significant amount of data with 2,000 in sampling, as well as the pet and the livestock impacts. We've been talking about whether or not we'll be sending out a follow-up survey, like let's say at 3 and 6 months, to take a look and see have things changed. But I think it's important to understand that this was kind of the first really look at a major chemical fire in a timeline where we had some real-time data both on the environmental as well as the overlay of the health impact and the pet and livestock. So first of all, I think probably ending, not first of all, first and foremost, we cannot thank the community enough who'd gone through a very, I'm going to say very tumultuous time. The significance of that. The community members that took the time to respond to the surveys when they were still kind of, going through maybe cleanup in their homes and kind of thinking through what all this meant. They participated, they provided information. And on behalf really of all of us that were part of that, everyone who responded helped to advance the understanding of the impact of chemical fires on the community. This was one of the largest samplings to date of individuals who were impacted, who responded, who provided us with information and trusted us with that information to do that. We cannot thank you enough, because it really will help inform us as we move forward about what things are protective, what things need to be put in place, how can we help move forward and further mitigate on these situations. So with that, I know this was not intended as a media, but I certainly am happy to open it up to questions from our, officials that are on and part of this, some initial thoughts.
Hi, Dr. Martell. This is Trisha Diddick, the Planning and Development Administrator for the Village of Rockton. I want to thank you and Katie O'Toole for this very informative presentation today. And I guess on behalf of the village, it's reassuring to see that while people were affected, it's not as I guess initially when this was first happening, we all kind of went to this could be really, really bad. And so what are the next steps for us as a community as we continue to navigate our way through the long-term effects of this situation?
So Tricia, I think that's a very important question. First of all, as the community continues its journey, first of all, we know that the EPA will continue on monitoring on the Beloit Corporation site. While the Chemtool fire was one incident, we know that there have been additional monitoring going on from that standpoint. And we are working with the CDC team about what the next step is. How soon should we look at? What should we look at in the follow-up time frame? Again, looking at how do we go back and query back? We know people are probably survey weary at this point and want to stop being asked questions, but it becomes extremely important to keep us informed. I mean, we have several individuals we were able to retain hospital records from that worked with us to get that, and wanted to make sure that we were aware of what was going on and wanted us to look at that. And I think that becomes, keeping vigilant about and then taking a look at what does it look like down, 6 months? What does it look like at a year? I think the other interesting part is what policy decisions will occur as a result of this as communities begin to look at, we know property transfers over, right? And so individuals kind of work through all this. We have when I say that, it's like, what is the story that we tell about this event, right? How did the community come together? What did they do? And I think that part of that discussion is, well, it was, to your point, it was an extremely disruptive event. The immediate impact was significant, but the timeline was also short. And so what does that look like moving forward? And hopefully we also inform other areas. When I look at the California wildfires, and we're now getting reach out for some of the data that's been put together about our short-term exposure. However, there are things that burn that are not intended to burn, in whether we are looking at, I'm going to say the larger wildfires that are burning. Nobody intends for people's homes and businesses to burn. And then in that is that burning of chemicals and things like that are not they have environmental impacts and then have human health impacts, and understanding those. So I think that is a process. And again, the involvement, engagement, we want to make sure that we're measuring it again at a time when it's meaningful and we get some supportive information for it. And I think it was interesting that pet and wild, I think all of us are learning much more about how important it is to consider the animals in any response. And I think they're always an after effect, but when you look at the number of people that had animals, both agricultural livestock, in addition to pets, the importance of making a plan. So when we evacuate, we didn't necessarily, I'm going to talk about the fish here that we heard about tragic loss of fish. I don't know if it's because we evacuated people for 5 days and they couldn't get back in their home to feed their fish, right? Because those aren't easily pets that you can evacuate. And so what can we do? And then what kinds of guidance can we build in the future to prevent if an event were to occur again, hopefully not ever in the same community again, but in the future, how do we help individuals help their animals? Because many people won't evacuate because of their animal care needs. Well, again, I want to thank, first of all, the Village of Rockton for cannot thank the community enough. I think that they came out, they were heard. There's a lot of information and data that's still in analysis, but I thought it was important to share out what we had learned to date and what we understood. I think the positive side of all of this is that everything that we learned with even the basic descriptive was consistent across the environmental impact data that we saw and learned about, as well as the human impact and as well as the pet and livestock. We're very consistent, but that does not mean that we won't continue to look at that data.
Thank you. I think that ends our presentation for today. And if anybody has questions, they can follow up afterwards. Thank you very much, everyone.
Thank you all. Have a great day.